Have you ever dealt with an itch that simply refuses to go away? Not the usual kind that disappears with a bit of cream or a quick scratch, but a deeper nagging sensation that keeps returning as if your body is quietly trying to say that something is off. For many people over the age of 60, a mysterious itch in a particular area of the body can sometimes be more than just dry skin. In certain cases, it may be one of the very first warning signs of serious conditions, including cancers such as lymphoma, pancreatic cancer, or breast cancer. What makes it even more unsettling is that these itching episodes can show up months before any pain, lump, swelling, or obvious symptom ever appears. In today's video, we're going to gently guide you through 5 specific areas of the body where ongoing unexplained itching might signal that something concerning is happening underneath the surface. These spots are not random, they form patterns that doctors and specialists have observed repeatedly over the years. Subtle clues that, when taken seriously, have led to early diagnosis and even saved lives. So, if you have been ignoring a tiny patch of irritation, or you know someone who keeps dismissing an itch as nothing, this is your invitation to pause and pay attention. Your body carries a quiet wisdom. Sometimes it does not shout through pain. Instead, it sends a soft but persistent message through a small, stubborn itch. If you feel ready to learn more as we explore this topic together, type the number 1 in the comments so we know you are here with us. And while you are watching, remember to subscribe to our channel for more gentle, easy-to-understand health guidance created especially for you because your well-being, your comfort, and your peace of mind truly matter. Be sure to stay with us until the very end, as we will share one powerful insight in the final section that may change the way you listen to your body and could even help protect someone you love. Sign 1: Itchy chest or under the breast. Susan was 69, a retired librarian with a calm presence and a meticulous way of living. She kept up with her health appointments, ate sensibly, and followed routines that gave her life a steady rhythm. Then, over the course of several weeks, something new crept in. A peculiar itch just beneath her right breast. It was not sharp or overwhelming, just a mild, persistent irritation that kept returning to the same exact spot. She did what most people would do. She switched to soft cotton bras. She changed her laundry detergent. She even went brayless for a few days to see if that made a difference. Yet the itch stayed. It did not spread across her chest. It did not bring a rash, bumps, or hives. It was simply there day after day, never quite intense, but never truly gone. I kept telling myself it was the heat, or maybe that my skin was just getting more sensitive with age, Susan later explained. But deep down, something about it felt wrong. What she did not realize, and what many people still do not know, is that one of the earliest signs of inflammatory breast cancer is not always a lump. Sometimes it is a sensation, a change in the surface of the skin, or in her case, an itch that refuses to leave. During her annual checkup, she finally mentioned it almost as an afterthought. Her doctor decided to examine the area closely. There was no obvious mass to feel, but there was something faintly unusual. The skin showed a bit of dimpling like the texture of an orange peel, and the area felt warmer than the surrounding tissue. That prompted further testing. Imaging follow-up studies, and then the diagnosis she never expected to hear. Inflammatory breast cancer, a rare but aggressive breast cancer that often begins in the skin rather than deep inside the breast tissue. What makes this type of cancer so challenging is that it does not always follow the pattern we expect. It may not present with a clear lump or sharp pain. Instead, it can appear as an area of redness, warmth, thickening, or persistent itching of the breast or chest skin. And while breast cancer is more commonly discussed in relation to women, men are not exempt. Men may overlook signs because they simply do not think of themselves as being at risk. An itchy spot near the nipple, a patch of skin that feels thicker than the rest, or a nagging discomfort under the chest muscle may seem minor, yet they can be early signals that deserve attention. So, how can you tell when an itch might mean something more than irritation? It tends to stay in one specific area instead of wandering around. It does not improve no matter how many creams, lotions, or detergents you change. It may come with small but important changes in the skin, such as tightness, warmth, or a slightly different texture. And most importantly, it lingers day after day. Susan's experience carries a powerful reminder. Your chest does not have to ache for something to be wrong. Sometimes all you notice at first is an itch. If you feel a stubborn itch on your chest, especially around the nipple or beneath the breast, do not ignore it. Bring it up with your doctor. Describe exactly where it is, how long it has been there, and what you have already tried. Ask for a careful examination. Real early detection starts long before a scan or a machine. It begins with paying attention to small, quiet changes and trusting that your body may be trying to get your attention. If this story resonated with you, type the number 4 inches in the comments to let us know. And remember to subscribe to this channel for more practical life-saving insights. We still have one final sign to share, and it is one you will not want to miss. Sign 2: persistent itch on the lower legs. For most of his life, Robert never gave much thought to a little itch. At 75, long retired from his job at the post office, his favorite routine was simple evenings watching baseball with his dog sleeping at his feet. Then one day, the itch changed. It did not feel like ordinary dry skin, and it did not show up after a new soap or detergent. This was different. A deep, almost burning itch that settled across the front of his shins. It always appeared in the same area, and it always seemed worse at night. At first, he shrugged it off. He reached for his usual lotion, then moved on to a thicker cream. He swapped out his bed sheets, stopped wearing socks to bed, and tried every small change he could think of. Yet every night, almost on schedule, the itch returned and refused to let him rest. There were still no visible clues on the surface. No rash to photograph, no bumps to point out, nothing obvious when he looked at his legs. Just that strange nagging sensation that felt like it came from under the skin rather than on it. Over time, another layer of changes crept in. Robert realized he was becoming tired more quickly. He woke up, soaked in sweat, even though the house stayed cool. He watched the scale drop by 5 pounds without changing his diet. None of it seemed connected, at least not to him, until a routine visit prompted his doctor to order some blood work. That simple blood test altered the course of his life. The results eventually led to a diagnosis of Hodgkin lymphoma, a form of blood cancer involving the lymphatic system, the network that helps regulate immune function and filter out harmful substances from the body. What his doctor told him was startling. In some older adults, lymphoma does not begin with obvious pain, lumps, or swelling. It can start with itching, quiet, persistent, and easy to overlook. As abnormal cells grow, they release inflammatory chemicals into the bloodstream. These substances circulate throughout the body and can irritate peripheral nerves, particularly in regions like the lower legs, where blood flow is slower and the skin is more delicate. The outcome is a burning, restless itch that refuses to settle because the origin is not on the surface of the skin. It lies deeper inside. That is why Robert's experience matters so much. There was nothing visible, nothing dramatic, only a stubborn feeling he could not escape, and he is far from the only one. Many seniors notice a similar ongoing itch and assume it is simply part of aging. The important distinction is this. If you have been scratching your shins or calves for weeks, especially during the night, and no change in lotion, soap, or laundry detergent offers relief, your body may be sending an early warning in the only way it knows how. If a lingering itch on the lower legs is becoming a regular part of your nights, do not dismiss it. This is especially true if it appears alongside other subtle changes, such as unexplained night sweats, ongoing fatigue, or unintentional weight loss. Talk to your doctor. Mention how long the itch has been there. Ask whether a blood panel is appropriate. Share the complete pattern, not just one symptom. Sometimes, the earliest indicators of a serious condition are not dramatic or painful. They are repetitive, easy to downplay, and they hide just beneath the skin. If this story feels familiar or struck a chord with you, type the number 1 inch in the comments to let us know you are paying attention. Keep watching. The next signs we are about to discuss may completely change the way you listen to what your body is trying to say. Sign 3: anal or genital itching. David was 76 when it began. A mild itching sensation, low down, uncomfortable, and difficult to talk about. At first it came and went, just a passing annoyance. He blamed the new toilet paper, then the dry air, then the incontinence pads he had started wearing at night. But as the weeks turned into months, the itch stayed with him. Sometimes it felt more like a burn, Other times it seemed so deep that scratching did nothing at all. He tried over-the-counter creams, changed soaps, and adjusted his diet. Nothing truly helped. And still he kept it to himself even from his doctor. "I just didn't want to make a fuss," he said later. "It was embarrassing. I assumed it was something small, probably hemorrhoids." But deep down, David sensed this was different. This irritation stayed on one side and felt like it came from inside, not just from the surface of the skin. Eventually, during an appointment with a colorectal specialist for an unrelated issue, he mentioned it almost in passing with an apology. The doctor suggested doing a scope exam to be thorough. What they found took him by surprise to a small lesion on the wall of the anal canal. It was an early-stage cancer discovered just in time. David's experience is more common than you might think, because when it comes to this part of the body, many people hesitate. We are taught from childhood not to talk about it, to tough it out, to keep anything involving that area quiet and private. But the reality is this: your health must come before embarrassment. Ongoing itching in the anal or genital region, especially when it lasts beyond 2 to 3 weeks and doesn't respond to basic self-care, is not something to shrug off. In many older adults, it can be one of the earliest signs of anal cancer or vulvar cancer in women over 60, and even penile cancer in older men, though that is rare. What makes this type of itch so deceptive is how easily it blends into everyday explanations. It is often blamed on hygiene issues, aging, skin reactions to pads or underwear, hemorrhoids, or simply getting older. Yet there are specific clues to pay attention to: itching that stays on one side, skin that feels thinner or looks different in color, a lingering, burning, or raw feeling that worsens at night, and no real improvement no matter what soaps or ointments you try. In women, vulvar cancer may begin as a small area of rough, thickened, or reddened skin that itches. In men, penile cancer can first appear as a sore raised area or thickened patch that itches and does not heal. In both situations, the earliest warning signs are often dismissed out of discomfort, modesty, or fear. But early diagnosis can change outcomes dramatically, and that process starts not with high-tech machines, but with noticing something as simple as an itch that refuses to go away. David's choice to finally bring it up probably extended his life. He caught a serious condition in its early stages because he chose honesty over silence, because he asked for help. So, if you or someone you love has been dealing with itching in a sensitive area for weeks, please do not ignore it. Do not assume you know what it is. Do not wait for it to get worse. Speak up. Let your doctor examine the area and ask the questions that need to be asked. That brief moment of embarrassment is a small price to pay if it means finding a problem early. If this story made you think of yourself or someone close to you, type the number 5 inches in the comments. And if you have not yet subscribed, consider joining us for more stories that truly matter. Your health is worth every question, every visit, every answer. We have one final message ahead. Stay with us until the end. It may change forever the way you respond to those quiet signals from your body: a faint itch on your leg, a strange sensation on your back, a small spot that feels different but not painful, something you could easily overlook and that most people do. Yet what if that tiny signal is your body's first attempt to warn you before the problem grows stronger, louder, and harder to treat? Sign 4: itchy scalp without dandruff. Thomas was 73, a retired school principal who loved his routines. Same simple breakfast every morning, same walk around the block, even the same sturdy hairbrush he had used for 2 decades. But in the last few months, something small began to get under his skin. A strange tingling itch on his scalp. It was not painful, his skin was not flaky, and it definitely was not dandruff. It just refused to leave. At first, he blamed simple things. Maybe his shampoo had gone bad, so he bought a new one. Then he suspected his favorite old baseball cap, so he stopped wearing it. Yet the itch remained. It did not cover his whole head, only a few small patches, near the crown right where his hair had thinned over the years. Thomas tried to put it into words. It felt like something crawling, he said. Not sharp, but almost electric. And the more he scratched, the less relief he felt. His wife Nancy noticed how often his hand drifted up to his scalp. "Are you sure it is not just dry skin?" she asked. But Thomas sensed that this was different. The feeling did not sit on the surface. It seemed to come from underneath. During a routine appointment, he finally mentioned it to his doctor. Nothing serious, he insisted, just an odd little itch that will not go away. His doctor decided to run a full set of blood tests just to be thorough. That is when the real concern appeared. Thomas's white blood cell count was noticeably high. After more detailed testing, he received a diagnosis he never expected to hear: early-stage chronic lymphocytic leukemia. For Thomas, that scalp itch was the very first and only sign. No pain, no swollen glands, no obvious illness, just that strange, persistent crawling sensation on his head. Later, his doctors explained that in certain blood cancers, like leukemia, the immune system can become overactive. It releases chemical messengers that irritate nerves below the skin, even when the skin looks perfectly normal. Combine that with age-related changes in blood flow and nerve sensitivity, and the scalp, especially where hair has thinned, becomes an easy place for those signals to show up. This has serious implications for older adults. We often chalk up new sensations like itching, tingling, or numbness to the simple process of aging. But not every new feeling is harmless. Not every itch is something to ignore. So what sets this kind of itch apart? There are no flakes, no visible redness. No matter what shampoo, conditioner, or scalp oil you try, it comes right back. It returns in the same areas, often at similar times, and it simply refuses to respond to normal care. For some people, that stubborn itch is the only external hint that something is changing in the blood. If you have noticed an ongoing itch on your scalp without dandruff, and you are also feeling more tired than usual, bruising more easily, or just feeling off in a way you cannot explain, do not dismiss it. Ask your doctor about getting a blood test. Even if the itch seems minor, especially if it lingers for weeks or months, it is worth checking. Thomas's early diagnosis bought him something priceless: time. Time to begin treatment before his condition progressed. Time to keep taking his morning walks with Nancy. And it all began because he decided to speak up about a symptom that seemed too small to matter. When no shampoo works and the itch keeps returning, your body may be asking for a closer look. If Thomas's story made you stop and think for a moment, type the number 3 inches, the comments, to let us know you are still with us. And if you have not yet subscribed, consider joining this channel for more practical health insights. Sometimes the quietest signals carry the most important truths. Sign 5: itch between the shoulder blades. Patricia was 70 when she first became aware of it. A peculiar little itch right between her shoulder blades, tucked deep in the middle of her upper back. At first, she blamed her posture. Then she thought maybe it was the tag on her sweater or the dry winter air inside her Michigan home. But no matter what explanation she came up with or what she changed, the itch remained. Almost every night, like clockwork, she would wake up reaching back to scratch that same unreachable spot. She started calling it her phantom itch. There was nothing to see in the mirror, no redness, no rash, no lump. Just that odd, restless feeling that seemed to rise from inside rather than from the surface of the skin. She tried one remedy after another. Moisturizing creams, long-handled back scratchers, switching laundry detergents, even investing in a new mattress. Yet the sensation never truly let up. It was annoying and distracting, but it did not feel like an emergency. She never imagined that such a small itch could be a red flag for something far more serious until her annual physical. During the visit, Patricia mentioned it almost as a side note. "It's probably nothing," she said to her doctor, "just this stubborn little itch that will not leave her alone." Her doctor hesitated, then recommended running some blood tests, just to be cautious. That decision changed everything. Her liver enzymes came back higher than normal, which led to additional scans. Those images uncovered a small tumor hidden deep in her pancreas, pressing on the bile ducts. That itch turned out to be one of the very earliest signs of pancreatic cancer. You might wonder how a problem so deep inside an organ like the pancreas could show up as an itch in the upper back. The explanation is actually straightforward. When a growing tumor begins to narrow or block the bile ducts, bile can no longer drain properly into the intestines. Instead, bile salts begin to accumulate in the bloodstream. One of the first things those circulating bile salts do is irritate nerve endings, particularly in areas with a rich network of sensory nerves, such as the upper back. The result is an internal feeling itch that is hard to describe, difficult to locate exactly, and nearly impossible to fully relieve. What makes Patricia's situation so remarkable is that this itch appeared months before any other warning signs. It came before the overwhelming tiredness, before her stools turned pale, before her urine darkened. That small persistent itch, the one she nearly kept to herself, may have been the clue that allowed doctors to find her cancer earlier. And her experience is not unique. Physicians across the country report similar stories. For older adults, this is especially important. As we grow older, our bodies do not always sound the alarm in dramatic ways. There is not always sharp pain or sudden swelling. Sometimes the very first message is as subtle as an itch you cannot explain. So, if you have noticed a continuing itch between your shoulder blades, particularly one that feels like it is under the skin and refuses to go away, do not simply brush it aside. If that itch shows up alongside unusual fatigue, darker than normal urine pail, or clay-colored stools, or unexplained shifts in appetite, talk to your doctor. Ask specifically about your liver. Ask about your pancreas. Ask before the symptom fades into the background again, because sometimes the back is the first place to reveal what your gut has not yet felt. If this story made you pause or rethink an itch of your own type, the number 2 inches the comments to let us know. And remember to subscribe for more health insights that could truly make a difference. There is still more to come, so stay with us. The 5 itchy spots we talked about today, the lower legs, upper back, scalp, chest, and private areas, are not random at all. They are not always about dry skin, aging, or a change in the season. Sometimes they act like small windows into what is happening inside your body. Quiet signals that something deeper may be shifting beneath the surface. And as we grow older, our bodies don't always raise alarms with sharp pain or dramatic symptoms. More often, they speak softly. They nudge. They leave little clues for us to notice if we're willing to look and listen. So here is the heart of what I hope you carry with you. When something feels off, do not simply push it aside. Don't let embarrassment, fear, or habit stop you from bringing it up. Your peace of mind, your ability to stay independent, and the years still ahead of you are worth every question you ask. It is completely okay to say, "This might be nothing, but I'd like you to take a look." Many times, early detection doesn't start with a big test or fancy machine. It begins with paying attention to something as small as an itch that refuses to go away. Listen to what your body is telling you. Trust that quiet inner voice. And remember, if an itch lingers and nothing seems to help, it may be more than a skin issue. It might be a message. Which part of this video made you stop and think? Have you or someone close to you ever dealt with an itch that didn't make sense at first? We'd truly love to hear from you. Share your experience, the insights you've gained, or any questions still on your mind in the comments. Your story could be the encouragement someone else needs. If this video gave you something meaningful to reflect on, please like, subscribe, and turn on the notification bell. We offer gentle, practical health guidance like this every week, created especially with you in mind. Thank you for being here with us today. Take good care of yourself. Your health matters every day, in every small, quiet signal your body sends.